epilepsy curable? What are the treatment options? Can one lead a normal life? When we talk about cure in epilepsy, typically we talk about control of seizures, which in most cases is achieved with medication. Epilepsy surgery can also be very successful and may cure epilepsy in selected patients. When someone is seizure-free for 10 years and off seizure medicines for 5 years, their epilepsy can be considered as resolved. A person who has age-dependent epilepsy syndrome but who is now past that applicable age can also be considered to have resolved epilepsy. Regarding treatment options, first comes medication. There are over 24 types of medications available. Which medication your doctor chooses will depend on your seizure type, how old you are, any other medical conditions you may have, other medications that you are taking, and whether you are a female of childbearing age. When your doctor prescribes medications, they will choose the one they feel is most suitable for you. So not everyone with epilepsy will be on the same medications. The medications which are used in the treatment of epilepsy are called anti-epileptic drugs, AEDs. Up to 70% people with epilepsy have their seizures controlled with anti-epileptic drugs. Epilepsy surgery may be considered when seizures are not responding to these medications. The aim of surgery is to stop or reduce the seizures when, number 1, seizures do not respond to anti-epileptics. Number 2, they are disabling and impacting the quality of life. Number 3, a clear surgical focus is identified and can be safely removed. Other treatment is vagal nerve stimulation, VNS. This therapy is a form of treatment for people whose seizures are not controlled with medication alone, or they have failed a surgery, or they don't want a surgery in the first place. The aim of VNS is fewer seizures as well as shorter and less severe seizures. It is used together with medications. VNS is a device powered by a battery placed under the skin of the chest wall on the left side, and the wire is attached to the left vagus nerve. The stimulation of vagus nerve can reduce the frequency and intensity of seizures in some people with epilepsy. Then there is a ketogenic diet therapy, KDT, which is an extremely low carbohydrate, high fat diet used to treat epilepsy, which has not responded to other treatments. The diet is specially designed to force your body to burn fat instead of sugar for energy. This produces ketones, which gives the diet the keto name. Of course, it needs to be supervised by a neurologist and a dietitian and integrated into the medical treatment plan. This alongside existing epilepsy medications. It requires a detailed medical and nutrition assessment to ensure that there are no underlying conditions that would make a KDT trial dangerous. Lastly, can someone with epilepsy lead a normal life? Yes. Most people with epilepsy live a full life and active working life. They play sports, socialize, travel, they take up hobbies. If seizures continue, some changes may be needed for their safety reasons, but it is still important to keep up as normal a lifestyle as possible. Thank you.